Good morning, everyone. My name is Perla Nunez, and I'm the Director of Outreach at Greater Gift, a nonprofit organization whose mission is to help the public understand the powerful role clinical trial volunteers play in the development of new drug, therapies, medicines, and vaccines. At Greater Gift, we are committed to changing the inequity that comes from many ethnic, racial, and demographic groups not being adequately represented in research. We work to build trust with underrepresented communities to engage them in research and ensure clinical research represents us all. Today, we have a special guest with us, Mr. Darius Ford. He is one of Greater Gift's newest board members who will join us in January of 2022 and is also the recipient of the 2020 Mary Hofmann Scholarship. Thank you so much, Darius, for joining us today. If you would please introduce yourself.
Sure, absolutely. So thank you for that, Perla. So I am Darius Ford. I was the recipient of the 2020 Mary Scholarship, where I'm attending Wake Forest School of Medicine to receive my Master's of Clinical Research Management. And a little bit about me, I started in the clinical research industry about 7 years ago, and I'm really excited of all that has happened along the journey, and really excited to speak to you this morning. So thank you for that.
Excellent. Thank you so much. How did you become interested in clinical research? What is your background story?
Sure, absolutely. It's actually a really cool story. So when I was really young, my mother, as most of my friends and family know, but most of you might not know that she was a science teacher in middle school, and she really is a biologist by trade. So she really is just really interested in all the sciences, and she really encouraged me to, pursue something in healthcare because I was just really interested in that. And so after I got out of high school and graduated from East Carolina, I started working at the hospital for doing wound care. And we really did a lot of, we really practiced a lot of post-market research on some of the wound care treatments and creams. And that kind of pushed me into the clinical research realm. And so I started to look around at where I might fit in as far as the different roles in clinical research, and landed in project management at PPD. And that is where I got my first start. So it's just kind of a really, everything just really aligned along the way. And now that's why me and Perla are now talking. So it's just really exciting. So.
Great. So you've been in the clinic, you've as enrolling people in studies, or more so on the back end?
So it was a little different. So I worked at Wake Med, and there were a lot of pharmaceutical representatives that would come into our wound care clinic. And these would be newly approved wound care creams that were new to Wake Med as well, that were proven to work. And so there were creams that some of the wound care therapists and surgeons would, try because of all of the research behind that cream. And my role in that was to be there for the patient, undress the wounds, help clean the wounds, and help apply some of those treatments if that was within the scope of my my job description. So it was, kind of like the study coordinator and PI, but really way post-market. So it was a little bit, we were a little bit more focused on already developed wound care treatments, since our patients were in really, critical conditions. So it was an awesome experience, and just to see how these new innovative treatments could lead to, wounds healing, so it was just an exciting thing to see. And a lot of our patients were excited as well to be able to have these treatments without a lot added burden to their already, stressful day. So
How exciting, right? That you got to see that side of clinical research.
absolutely.
So I'm glad that, that experience for you is what wanted you to pursue a higher degree in the field.
Yes.
So
Yep.
that's excellent, excellent. How has COVID affected you and your family? And then also, I'd like to know how COVID has affected your community.
Absolutely. So starting with my background in, with my health,
Mhm.
I have had asthma for most of my life. So I've already been really cautious about my breathing and my respiratory symptoms. And so when COVID came, it was a little bit scary for me. And I know a lot of other
Mhm.
patients that have any type of respiratory issues were also really nervous. Yeah. So, it really just I opened my eyes even more to the dangers of all the viruses that are out here and how important it is to be vaccinated or at least make an informed decision on that. And for my community, it's even more important because in the Black community and a lot of minority communities, we do have high rates of different type of respiratory diseases and cardiac diseases. So I think that at least being aware of the COVID symptoms, what can come of it, and how to protect yourself from, all of the COVID symptoms and all of the issues that come with that. I think that's extremely important. And my family also lost a family member this year to COVID. And it was definitely a very, very eye-opening experience for most of my family as well. And it is unfortunate, that the world has to learn through the deaths of some of the COVID patients, but um, I do think that we're going in a good direction as far as awareness and protecting ourselves.
Yeah. Thank you, Darius. And actually, Greater Gift just posted on LinkedIn and our social media the numbers representing the lack of diversity from the Association of Clinical Research Professionals website. And it shows that African American population in the United States is 13.4%, but only 5% of the population is involved in clinical research. The Hispanic or Latino population represents 18.1% of the population in the US, but only 1% participate in clinical research. So, yes, we need to do better. We need to change the narrative, and we need better, more involvement from minority populations in research. So, this leads me to my last question. So, diversity in research is so important. What is your message to diverse patient populations about their consideration of participating in clinical trials?
Absolutely. And I think that this is probably one of the most critical and important questions in not just clinical research, but just in healthcare in general.
Mhm.
Um, so, as far as the minority populations, the Black community, the Hispanic community, and all other minority populations, the goal is to provide treatments that are able to treat the population that is intended for. But within clinical research, we see that a lot of these treatments are, we're doing trials on, subgroups of the population, and the treatment population is not diverse enough within that trial. So it's basically making medicine work for us, and not to silo the groups, but make it work for minorities. Because if we're taking medicine that little to no research has been done on our population, then we're really not knowing what we're getting because we weren't a part of that clinical trial and we didn't participate. So it's a risk, but it's always a risk regardless. I think if you take a drug that's post market, right, and uh, none of I can look at the trial data and see that nobody that looks like me was in that trial. I would think that I would be a little bit more nervous taking this drug, for example, like a Tylenol. So it's just extremely important for us to be represented within the clinical trials as well, because we never know where that treatment can lead to, and if we're going to have to take that down the road when it's approved. So,
Yeah. Thank you so much. Yeah. And I think that, as clinical research participants, ask all the questions that you have, make sure your questions are answered in a way that you understand. But just consider participating, because I participate in clinical research because I want my children and my grandchildren to not have to go through some of the hardships of diseases or that are happening right now. But I call it for myself my pay it forward, right? I'm
absolutely.
doing my part now, but I do ask a lot of questions when I participate in clinical research. So,
Absolutely.
but it's very important that we are all represented in
And
research.
I wanted to add to that too, Perla.
Yeah.
I also participated in a clinical trial when I was little, for asthma, actually.
Okay.
So it was an allergy and asthma trial.
Uh-huh.
And, although I don't remember the details, I would have to think that that might have something to do with me being so involved in clinical research. But, it was an asthma trial. And it directly affected me then, and it directly affects me now. And
Right.
I tell everyone that I am around, at least, that the scientists, the researchers that are involved in this are so passionate to actually finding treatments, because it's not just us versus them or us versus you. It's literally trying to bridge that gap between
Right.
research participants and researchers in healthcare. So I think that it's just more important for us to all be, collaborative within this effort. Even if you are informed and don't want to participate, you could at least, maybe forward a trial or some information onto somebody that
Mhm.
might be interested. So
Yes.
you at least want to give people the opportunity to participate, based on making an informed decision, which is extremely scary and it's hard to do. But that is at minimum the goal. So.
Yeah. Oh, thank you so much, Darius. That was a wonderful message, that even if a study is not right for you and you've made your decision to not participate, you should still be an ambassador for studies and share it with
Mhm.
family and friends and see if it's something that could benefit them or that they would be interested in considering.
Absolutely.
So, thank you so much, Darius. And I look forward to seeing you on our board meetings
Yes, this is
coming
going
up
to
in
be
December.